New South Wales recorded 98 locally cases of COVID in the 24 hours to 8 p.m. last night. As the Premier said, we've still had 20 cases that were infectious in the community for over 1 day. It is important that we get that number down. But it is pleasing to see that the venues have been narrowed and that people appear to be taking the health advice about limiting the time spent anywhere and also not going out when you're sick. COVID is a severe illness, and I just want to highlight the fact that again, what the Premier has said, that COVID can be spread to others even if you don't have symptoms. So we're getting a lot of misunderstandings that if I'm well, how could I possibly infect someone else? And the reality is you don't know. You don't know that you have the disease, and actually, with this Delta variant, you're actually most likely to spread it to others even just before you've got, around that time when you've got symptoms. Before you have no symptoms at all, you are most likely to spread it. And so, again, please do not visit anyone. What we want you to do is stay within your households. In terms of the locally acquired cases, the majority still are in southwestern Sydney Local Health District. And can I extend my utmost gratitude to the community of southwestern Sydney who have come out for testing and are actually bearing the burden of this impact of COVID on them and their loved ones. And I just want to acknowledge the way that the community is responding. But unfortunately, it is the Delta variant, with its transmissibility, requires us almost to be perfect at all times. So don't go and visit anyone else. Don't have anyone into your home. Please be so safe when you're going outside. Wear a mask and make sure it covers your nose and mouth when you're entering any indoor premises, queuing. Make your trips as short as possible. And remember that message about chemist shops, pharmacies. Don't go there if you've got symptoms. Instead, you should be actually going and getting a test. In terms of the cases by local government area, again, Fairfield local government area has 47, Canterbury Bankstown 13 and Liverpool 13, reflecting the fact that the disease burden in those areas is significantly high. We are seeing a lot of still the pattern that a lot of them are households. So once we find one case in a household, the remaining household members soon are almost positive at the time of detection or soon become positive. There are currently 82 COVID cases admitted to hospital, with 24 in intensive care. And of the 24 people in intensive care, one has had a vaccination, with one person having had a dose of AstraZeneca vaccine. Again, vaccination is critical. Can I just urge everyone in the community who is eligible for the vaccine to go forth and make an appointment. Go on to the eligibility checker and access the vaccine. I would urge anyone, in particularly over 60, to go and get an AstraZeneca vaccine from their general practice. And remember, I've also said that GPs are working very hard and they will prioritise older individuals over younger in terms of bookings because of the need to protect our elderly. But even one dose of the AstraZeneca can have some effect, as well as the one dose of the Pfizer, but 2 doses gives that optimal protection. And both having those 2 doses of the vaccine can really reduce your risk of hospitalisation and death associated with COVID. The areas of concern for increased testing are Lakemba, Punchbowl, Fairfield, Bankstown, Liverpool, Cumberland, Marylands, Guildford, Wollongong, Blaney, Parkes, Coffs Harbour, Crow's Nest, St Leonards, Mittagong, Burradoo and Georges River, Bayside and Sutherland Shire. And this goes to my final point, that we do need to make sure that we aren't complacent, that this is just an issue in southwestern Sydney. It is far from. What we need to do is every time we leave our house, be vigilant in who we interact with. We've talked a lot about reducing mobility, but in essence what we're talking about is reducing the opportunity of bringing people together, because that is ultimately how COVID is spread. Why we're concerned about workplaces is they bring together people from different parts, geographical areas, and so have those characteristics of potentially introducing COVID, if we have a workplace transmission event, into other settings and other communities. So whilst there will be the need for some critical work to go on, we do need to support the functioning of society. It is incredibly important that as we go about our workplace functions, that we take this threat seriously and follow the health advice. Thank you.